that even if you have a family history of it, there's still a 71% chance that you won't get an autoimmune disease. But that's only if you play your cards right. So pay attention to what I'm going to be telling you, because there's so many things that contribute to the onset of autoimmune disease that all of us get exposed to every day. This is the 5th post now on my new series on the epidemic of autoimmune diseases. Yeah, it's an epidemic. We need to know what's causing that epidemic. We need to know, based upon that, how to prevent the rest of us from getting this disease, because up to almost a quarter of the American population right now has a disease, and it's doubling at a remarkable rate. It's going to be better than half the next generation, unless we do something about it. These diseases can literally be cured, but they can't be cured until you know the cause. So let's talk a little bit about that. First, let's look at genetics. Researchers have discovered several genetic factors that can lead to autoimmune disease. For example, a man or a woman with a first-degree relative, that would be either a parent or a sibling, with an autoimmune disease is 30% more likely to get an autoimmune disease than everybody else who doesn't have that family history. So there's definitely some genetics to this. That, of course, means that even if you have a family history of it, there's still a 71% chance that you won't get an autoimmune disease. But that's only if you play your cards right. So pay attention to what I'm going to be telling you, because there's so many things that contribute to the onset of autoimmune disease that all of us get exposed to every day. So if you have that first-degree family relative with autoimmune disease, you need to be paying special attention to this. It all depends on the many other factors that we're going to address in this series. And one of those factors that is responsible for the autoimmune epidemic is estrogen deficiency. Get this now, understand this. Women are almost twice as likely to come down with an autoimmune disease as is a man. Why is that? Additionally, postmenopausal women who their doctors give them hormone replacement therapy are much less likely to develop an autoimmune disease than postmenopausal women who are denied for some reason hormonal replacement therapy. That should give you a clue as to why women are the primary targets of autoimmune diseases. There's a huge connection with the hormone estrogen. By the way, men make estrogen too. We have not seen any publications on estrogen levels in men as we get older, because as we get older, lots of times our estrogen levels go down. Sometimes they go up though. So depending on what's going on with men as we get older, we may be more or less likely to develop one of these autoimmune diseases, but it's primarily a female disease. Now in the next post, I'm going to expand a little bit more on this estrogen connection and why replacing estrogen in postmenopausal women dramatically reduces their risk. Okay, we'll see you then.